So my name is Dr. Thomas McDonnell. I'm an Associate Professor of Biomarker Discovery. My role in the department is I'm one of the basic scientists, so I'm kind of method development and expanding what we are capable of doing and then trying to match it to what the clinicians need us to do. So being in biomarker development, I can be quite flexible. I can move between different diseases. My biggest project at the moment is seronegative rheumatoid arthritis, where 30% of people with rheumatoid arthritis or RA don't have the classical antibodies. Because they don't have those classical antibodies which really help clinicians diagnose them, they get treatment delays and diagnosis delays of up to 12 months. RA treatment is generally best in the first 12 months, and those delays can affect them up to 5 years later, with some studies saying every week lost in the first year costs you months later down the line to try and get into remission. So my main focus at the moment is finding those new markers that will get those patients included within the first few months. It's a solvable problem if we develop the right methods and technologies for it. So we spend our whole careers working on things that we can never see, really. I do structural work, so sometimes I do get to see it, but we work on things with the assumption they're there and we measure them by surrogate signals. So when I'm at home at weekends, I do a lot of woodwork. I do a lot of 3D printing, which is, seeped into work as well now. So I 3D print things for work, structures of proteins and that. And I do something called epoxy pouring, which is when you see those tables that are half wood and half epoxy with like the waterfall effect. So I make those in my spare time as well, because it's kind of nice to have something where you can instantly see if it's worked, rather than like a grant project where it's a month before we figure out if it's actually done the thing we needed.